So patients would ask me, what can I do? Dr. Murphy, you look so healthy, you look great, what are you doing? And I would share with them things that I was doing in my own life as a triathlete and what I was doing to take care of myself. And as I did, I started seeing patients get even better. And I started doing functional medicine testing. This is a special type of testing to look for different conditions that individuals would have breakdowns in their chemistry. And as I started treating what I call the medical misfits, these are the people kind of been everywhere, tried everything, or they just wanted to go a different route other than conventional medicine. They started hearing about some of the patients that I was helping. One of the patients that came to see me early on, this is in the early 1990s, was well, actually, yeah, it was late 1990s, I guess, but this is Sheila Jones. So Sheila came to me with a diagnosis of fibromyalgia. I had never heard of fibromyalgia. Back then, we really didn't know much about it. Most people didn't talk about it, and most doctors didn't know what to do with it. Unfortunately, they don't know what to do with it now. But I had to decide. This patient was sitting here in front of me, and after I'd taken her history and spent some time with her, my first thought was, "Oh my gosh, she's a hypochondriac," because she had so many symptoms, right, with fibromyalgia. But I realized the more I spoke with Sheila, the more I realized, she's not making this stuff up. She's got this real condition, and no one really knows what to do to help her. The rheumatologist had basically told her, here, take amitriptyline, Flexeril, and non-steroidal anti-inflammatories, and then come back and see me in 3 months, and we'll see how you're doing. I don't know what else really to do for you, with your chronic pain and your fatigue. But I started working with Sheila just using special testing, as I mentioned earlier, functional medicine testing, and then started using high doses, but the right doses and combinations of certain vitamins, minerals, amino acids, essential fatty acids. And Sheila was able to overcome her fibromyalgia in 3 months. Now, I know when you hear that, you think that can't happen. And so let me stop you right there. I totally understand. Now, what I found out pretty quickly is it didn't always happen that way. In fact, that was the outliers. Sheila was the outlier. She wasn't the norm. And as I started getting more and more fibromyalgia patients referred to me to my clinic, I realized, wow, these are some really tough patients. But it sparked in me this mission to figure out what was going on with these patients and to do everything I could to help them get their life back. As you know, with fibromyalgia, oftentimes it takes your job. You can't work, you have to go on disability. It can rob you of your friendships because people don't understand what you're going through. One day you feel good, next day you don't. You never know if it's going to be a bad day. The weather changes, so you end up making plans with your friends, and then you have to cancel at the last minute. And eventually they just give up on you, right? And they don't understand what you're going through because you look normal, you look fine. And so you lose your friends. And oftentimes, if even family members don't understand what you're going through, you lose your hobbies, the activities that you used to love to do. You find that it's hard to exercise. You find that it's hard to garden, cook, clean, whatever things that you normally took for granted, and things that you both enjoyed and didn't enjoy, like cleaning the house, or maybe even a difficult job. You see that now with fibromyalgia, you've lost all that. And unfortunately, we see with fibromyalgia, this is a growing condition brought on. I think a lot of this is going to be brought on by COVID, long haulers, and just the stress. You'll see here, we'll talk a little bit about that. Now, last week I went into a lot of depth about what brings on fibromyalgia, and I'm just going to go over that briefly tonight, and then I'm going to get into what you can do to reduce your pain. That's the biggie. So we're going to talk about that tonight before I take your questions. But fibromyalgia is a syndrome characterized by widespread body pain and fatigue, and it affects over 4 million U.S. adults, about 2 to 8% of the population, adult population, and about 3 to 6% of people worldwide. It primarily affects women. Not about 95% of the people with fibromyalgia are women between the age of 20 and 50. The criteria for diagnosing fibromyalgia was generated or came about by the American College of Rheumatology in 1990. It's changed over the years. In 2011, in the last few years, so I guess maybe 2017, 2018, they changed the criteria, updated it, but this is the criteria to be diagnosed with fibromyalgia. It's a process of elimination. So oftentimes people will, have to see 7 doctors and may take 3 or 4 years before they ever get the diagnosis. It's a process of elimination. They will do a battery of tests. Typically those tests come back normal. They want to rule out autoimmune disease like MS or lupus or rheumatoid arthritis. But once they rule those things out, then eventually they tell you, well, you have fibromyalgia. And, with so many symptoms associated with this illness, headaches, sleep disorders, brain fog, we call it fibro fog, poor memory, anxiety oftentimes is part of fibromyalgia, depression, obviously diffuse achy, sometimes disabling pain is the big one, but fatigue, muscle cramps, restless leg syndrome, irritable bowel, bloating, gas, indigestion, constipation. These are just some of the things that we see in fibromyalgia. And the medications that are often recommended for fibromyalgia, like Neurontin or Lyrica, are associated with numerous potential side effects. Ironically, one of the side effects of Neurontin and Lyrica, pregabalin and gabapentin, and Grillis, they're all really the same thing. But ironically, one of the side effects is diffuse achy pain. Nerve pain, even though it's supposed to block nerve pain, it can cause nerve pain. It can cause brain fog, anxiety, depression, poor sleep, weight gain. It's not unusual for individuals to gain some 40 pounds in the first 6 months on Lyrica. It increases your risk of type 2 diabetes. It is, it's a drug that offers very little relief for fibromyalgia. Now, if you're getting relief on Lyrica and Neurontin, then great. Just realize there's all sorts of nasty side effects associated with those medications. The studies show that 30% of the people who take Lyrica or Neurontin notice an improvement in their pain. Of the 30% who share that, 50% will go on to then stop those medications because of the side effects. Now, I'm not telling you to stop any medications. Don't do that unless you're working with me or you work with your doctor. You can't just stop your medications. But what I'm sharing with you is that in the conventional medical world, what they have falsely come to this conclusion is that you just have to learn to live with it, because they've realized that the medications that they're using to treat fibromyalgia don't work. And if we look at these, again, like Cymbalta is another one, Savella is another one, and then sleep medication. But look at all this, look at all the symptoms here. So it's important to know also that fibromyalgia is just a name. That's all it is. It's a name given to describe a group of common symptoms that people have. We call it fibromyalgia. And when we do that, we know that that means that they have diffuse achy, sometimes disabling pain, fatigue, poor sleep, restless leg syndrome, brain fog, these type of things. But fibromyalgia doesn't cause brain fog. It doesn't cause pain. It doesn't cause poor sleep. There's underlying causes of fibromyalgia. However, in conventional medicine, it's about treating symptoms more so than causes. If you have fibromyalgia and they start looking at these symptoms, they're going to, if you've got something, they're going to put you on something to put you to sleep, all right, sleep medication, because you can't sleep. Then they're going to put you something to wake you up. Then they're going to put you on something to speed you up because you have no energy. Then they're going to put you on something to slow you down because you have anxiety. Before you know it, in conventional medicine, you can be on half a dozen to a dozen drugs. It's not unusual for my patients that I work with, whether it's here in the United States or even overseas. I work with patients all over. It's not unusual that they're on half a dozen different prescription drugs. And they all report that they're not working because they don't work, at least not long-term. But that's conventional medicine. It's based on really treating the symptoms, trying to reduce those symptoms. And obviously there's a place for that. If you have chronic debilitating pain, you want to take something that's going to help reduce the pain. The problem is with pain medication, you end up taking more and more pain medication because eventually it quits working, or you have to take something stronger. It makes more sense to look at it from a functional medicine approach. That's the way I practice and have for the last 20 years, where we want to look at what are the underlying causes of the symptoms of fibromyalgia. What's causing the pain? What's causing the poor sleep? What's causing the low energy? If we know that, then we can fix those causes. No one has a Neurontin deficiency. No one has a pain pill deficiency. So when we look at the causes of fibromyalgia, we know that there's several common things that people have with fibromyalgia, but stress is the big one. And stress can come in many forms. So it can be real or imagined. If you go to a scary movie and you're watching a scary movie, the stress that you're under watching the movie it's not real. This is make-believe, right? This is Hollywood. But your body still is releasing these chemicals, and it still is going to have the effects of the stress that you're under. Now, you could have physical stress, so you could be, or maybe you used to be an athlete and you put yourself under a lot of stress that way, but maybe you have a lot of mental stress. So a really demanding job or demanding, home environment. Could be trauma, some type of accident. Could be you had a stress of some type of injury or surgery. And it can be chronic stress that builds up over the years from a toxic marriage, a toxic workplace, or it can be an acute, something that happens recent type of stress. That's the straw that breaks the camel's back, the death of a loved one. It could be from, like I said, from a surgery. There's all kinds of things that can bring this on. But we know that when you get under too much stress, it starts to affect the hypothalamus, pituitary adrenals, what we call the HPA axis. Now, the hypothalamus is a bundle of nerves, is an organ in your brain that controls, look what you can see what it controls. It controls just about everything, right? I don't know why I can't get this out of here. It controls our sleep-wake cycle, so how well or how poorly we sleep. It controls our mental clarity, our brain chemicals, our neurotransmitters. It controls our pain. So do we have a high pain threshold or low pain threshold? So it's always monitoring and controlling these different systems in the body. We make, and I use this analogy, I did this last week, I'm gonna go through here quick, but I use an analogy that we're all born with a stress coping savings account. And in that stress coping savings account, we have chemicals that allow us to be able to deal with stress. And all day long, we're under stress. Anytime we're under stress, we're using these chemicals that we have. Hopefully we have them in our savings account: serotonin, dopamine, norepinephrine, pantothenic acid, B5, magnesium, B vitamins. These are stress coping hormones, vitamins, minerals, and enzymes that the body needs to be able to handle stress. We make deposits into our stress coping savings account by getting deep restorative sleep. Now, last week I went into step-by-step sleep protocol. So if you didn't get a chance to see that, I would encourage you to go to the Facebook page and watch the presentation where I go into when I go into those protocols. You can also go to your Fibro store, and there's some free jumpstart videos. One of them is on part 1 that talks about how the protocols for deep restorative sleep. So you can see that there. But you got to get your sleep straightened out, because when you go into deep restorative sleep, that's when the body's repairing itself. And it's also when it's making deposits into your stress coping savings account to allow you to be able to handle stress the next day. When you deplete your stress coping savings chemicals, stress becomes magnified and you start to have more pain, because when you become deficient in serotonin, and everybody with fibromyalgia is deficient in this brain chemical called serotonin, your pain threshold goes down. So your pain threshold goes down, pain goes up. The lower your pain threshold, the higher your pain. And it doesn't matter where that pain's coming from. It could be coming from wear and tear on your joints, some kind of scar tissue. It can come from wear and tear arthritis. It can come from bone loss, osteoporosis. It can come from oxidative damage, oxidative stress, which we're all under, free radical production. These things can create inflammatory chemicals, leaky gut, SIBO, bacterial overgrowth, food allergies. They generate inflammatory chemicals that for most people, probably no big deal. Maybe a little bit achy pain here and there, or maybe an upset stomach, or, but for fibro, because your pain threshold is so low, these underlying problems create and they accentuate your pain. So we look at one hormone called substance P. Now, when you go into deep restorative sleep, you're releasing and making more serotonin. You're banking that for in the future. And the higher your serotonin level, the less pain you have, the happier you are, less anxious you are, the better your mental clarity and you're less likely to have irritable bowel. And I went over all that last week, so I'm not going to go into detail like I did last week. Don't have time. But one of the things that happens when you go into deep restorative sleep and you start to fill your brain up, your stress coping savings account up with serotonin, is you now can reduce substance P, this hormone. The higher your substance P level, the lower your pain threshold. It creates more pain. We know if you're not getting deep restorative sleep, you increase your inflammatory chemicals by 40%. Now, realize, please, that the majority of everyone out there that you know walking around on this planet has inflammation. Everyone has inflammation. It's part of life. You have inflammation, and good inflammation, you have bad inflammation. But we all have inflammation, and most every illness out there is caused by inflammation and stress. Those are the triggers. But you can see the importance of serotonin, this brain chemical. Now, I talked last week about where does serotonin come from? This brain chemical comes from an amino acid called 5-hydroxytryptophan that we should be getting in our food, in our protein foods. But for many people, they can't make the conversion from the foods they eat and turn it into serotonin. So the first part of the jumpstart process, jumpstart protocols, is deep restorative sleep using 5-HTP. 5-HTP combined with the Fibro Formula multivitamin with the right doses and combination of B vitamins, magnesium, vitamin C, and other amino acids. When it's combined with 5-HTP, it turns into serotonin. So people may be taking an antidepressant, but the antidepressant doesn't make serotonin. It only helps you hang on to what you have. But if you've depleted that, it's not going to really do anything. So 5-HTP, which you can buy with a counter, not only does it increase your pain threshold, so you have less pain, help with mental clarity, help with your moods, help with the irritable bowel, but it also increases your sleep hormone melatonin by 200%. So I went over that last week. Now, what we're trying to do with the Jumpstart protocols, last week we talked about sleep. This week we're going to be talking about vitamins and minerals and essential fatty acids and why they work if you take them the right way. What we're trying to do is to raise your pain threshold, okay? Because you have a condition called allodynia. This is a medical condition that just means low pain threshold. So for you, pain is wherever it's coming from, it's magnified. Now, we can give you a pain pill, or we can give you Neurontin or Lyrica. We can give you these things to help reduce the pain, this pain message. But wouldn't it make more sense to raise your pain threshold? If that's the cause of your pain, and it is, wouldn't it make more sense if we had a way to raise your pain threshold? Well, in conventional medicine, there's no pill for that, but we can do that. I'm going to share with you how we do that. So you have two things. You have allodynia, which means low pain threshold, pain's magnified, and you have hyperalgesia, which means your pain receptors are heightened. They're on heightened alert, and it's associated with this thing called central sensitization syndrome, which is a miscommunication between the nerve impulses and the central nervous system. And that's why with fibromyalgia, a lot of times you're really revved up, you're overstimulated, and this creates more pain. Pain's magnified. What we want to do is to tone this down. Now, again, you can take a pain pill, but that's not solving the low pain threshold. In fact, pain pills actually create more pain later on. We know that to be true. So when you get into allodynia, you get in this vicious cycle of pain and fatigue, because when you're under stress, real or imagined, doesn't matter where that stress is coming from. It could be stress you don't even know you're experiencing, pollution, your diet that's creating oxidative stress and inflammatory chemicals. But chronic stress disrupts the hypothalamus, which is supposed to be regulating all our systems in the body. And once that happens, you create allodynia, and you have a low pain threshold. And so that creates chronic pain, which makes it oftentimes impossible to get a good night's sleep. So this causes this causes poor sleep. That leads to more fatigue, increased sensitivity to pain. Your pain threshold goes down even further, so pain's even more magnified. Increased inflammation, suppressed immune function, and lowers your metabolism. So it increases your risk of type 2 diabetes, increases your risk of hypothyroidism, autoimmune disease, including Hashimoto's thyroiditis, rheumatoid arthritis, weight gain, brain fog, anxiety, depression. Anytime you're not getting a good night's sleep, this is what, you increase the risk of developing these things. So chronic poor sleep further depletes the serotonin, which triggers IBS, more pain, low moods, and fibro fog. Now we know, and I'm going to fly through this. Okay, so bear with me because I want to make sure I get your questions. We know with research findings that in fibromyalgia, there's a mitochondrial defects. The mitochondria are the energy, the spark plugs of the cells. So they're the energy packets. And when you have, not only do you have a defect in them with fibromyalgia, they're not working correctly, you also have less than the normal person. So you're already at a disadvantage metabolically, energetically, your cells have less mitochondria to work with. So you're already at a disadvantage. And then if they're dysfunctional, okay, due to oxidative stress, this free radical production, then we start to see neuroendocrine disorders show up, like tingling in your hands and feet because of poor nerve communication. Start seeing problems with low hormones like brain hormones, serotonin, dopamine, norepinephrine, low cortisol, our stress coping hormone, low DHEA, which helps with our mental clarity, helps with our circadian rhythm, sleep-wake cycle. These hormones start to become suppressed because of this disruption in the hypothalamus, pituitary, adrenal apparatus. Vitamin D is commonly deficient. Your vitamin D level should be above 50. You have elevated brain glutamate, which can create brain fog and a hypersensitivity to pain. Homocysteine level, a marker for inflammation. Interleukin 8 and 6, these are markers for inflammation. These are all part of fibromyalgia. Elevated lactic acid levels, because the mitochondria are not working correctly. You can't use oxygen, so you become your muscles can't use oxygen, and that's why you start having cramps and trigger points and muscle pain. Magnesium deficiency is decreased by 31%. Now put that in perspective, knowing that probably about at least 50% of the population is deficient in magnesium based on the RDA. We're going to see that here in a minute. But in fibromyalgia, just anybody with fibromyalgia, unless you're taking magnesium, you're deficient in magnesium. Magnesium is a natural muscle relaxer. It's in 300 different processes. And when you're deficient in it, your mitochondria don't work correctly because you need magnesium as part of the Krebs cycle, this energy cycle. You need it to fuel the mitochondria. Magnesium is a natural muscle relaxer, so it relaxes tight, achy fibromyalgia muscles. It also relaxes tight colon. So if you have constipation, 70% of the people with fibromyalgia have irritable bowel syndrome. If you have constipation, it's often a sign of magnesium deficiency. Do you get little twitches in your eyes? Okay, that's magnesium deficiency. High blood pressure is associated with magnesium deficiency. Mitral valve prolapse, magnesium deficiency. Migraine headaches, tension headaches, migraine deficiency. So we know that, I already mentioned mitochondrial defects, so we're not going to spend time there. Magnesium deficiency can trigger hypersensitivity to pain due to a reduction in NDA, N-methyl D-aspartate. When you become low in magnesium, you can't block NDA, and that creates more inflammation. So that's why it's on here. And also that increases more lactic acid buildup. So trigger points, these tight, achy, these points you can feel on your body. And it also increases oxidative stress or free radical damage, which generates more pain chemicals. You mentioned vitamin D. So we'll go there. Oxidative stress is a big one with fibromyalgia. Now it's interesting because Dr. Janet Trevell, she was the White House physician for Presidents Johnson and Kennedy, and this is really kind of recognizes the definitive myofascial pain workbook. I mean, this tome here, I forget how many hundreds and hundreds of pages it is, but there's chapters in here all about how muscle pain in general, soft tissue pain, joint pain, muscle pain can be triggered by nutritional deficiencies, by vitamin, minerals, amino acids, and essential fatty acid deficiencies. And this was, this was back in the 60s. So we've known this. It's just that, unfortunately, uh, even though we know that vitamins and minerals play a role in do we experience pain or not, we got jaded to it. And I understand, because with fibromyalgia, you've tried so many different things and they don't work. So you've tried different drugs, you've tried different diets, you've tried different therapies, whether it's acupuncture, PT, chiropractic, massage, whatever it is, pool therapy. None of it's worked. Exercise makes you go into a flare. You've tried different vitamins, different, noni juice and fruit plus, and there's so many things out there, right? Turmeric and these different things, and you've tried them and have never really made much of a difference. So you give up. And let's face it, I mean, fibromyalgia is a very tough illness to have. It's very, it's very intimidating to most doctors. And to think that the best way to treat it is a natural approach by using vitamins, minerals, and amino acids, essential fatty acids. Most people think, oh, that can't be right. Give me the good stuff. Give me the heavy duty stuff. Give me the drugs. But we know that drug therapy long term, I mean, over a 15 years period, when we look at surveys, it shows that people are no better off on prescription medications after 15 years. And I mentioned earlier all the potential side effects. So vitamins and minerals and amino acids, essential fatty acids, these are what make your brain chemicals. That's where serotonin comes from. That means where the brain pain blocking neurotransmitter norepinephrine comes from. The energy generating adrenaline that should be coming from your adrenal glands, it comes from vitamins and minerals. Your thyroid hormones, they come from vitamins and minerals. Your pain blocking inflammatory chemicals come from essential fatty acids, so fish oil. And I can go on and on and on. This is just biochemistry. In medical school, they get one class in nutrition, and that's it. So they don't really look at this. But the only way to overcome fibromyalgia is you got to get healthy. And the only way to do that is to make sure that you supply your body, the cells, with the nutrients you need. Now, most of you have tried Centrum Silver or One A Day or something from Walmart or Puritan's Pride or some of these inferior vitamins out there, not to step on anybody's toes, but it is what it is. You get what you pay for. These supplements are based on the RDA, the recommended disease allowance. It's just enough to keep you from getting beriberi or scurvy, but it's not going to do what we need it to do because it's not high enough strength. It's not going to saturate the cells with these chemicals that your body needs to be able to reset itself. And so you're always deficient. The Fibro Formula that I use when I'm talking about optimal daily allowance instead of recommended disease allowance, the Fibro Formula, you would have to take 100 bottles, 50 to 100 bottles of Centrum Silver or One A Day or Puritan's Pride to equal what's in the dose of the Fibro Formula. The Fibro Formula is a high dose multivitamin supplement with special forms of magnesium, malic acid, which helps the mitochondria repair themselves, CoQ10, which is the spark plug. This enzyme is the spark plug that helps the mitochondria work. It's in there. All the amino acids, which are the building blocks of all your hormones, are in there. So, and then antioxidants to reduce the oxidative stress. This is a supplement that I've relied on. That's changed over the years, but I developed this years ago when we would have patients that were coming to the medical clinic and they were getting high doses of vitamins and minerals through IV, intravenous therapy. The problem with that is we'd have people travel 2 or 3 hours every week to come get these IVs, and they felt better. They had more energy. They had less pain. Mentally, they felt better, stronger. They slept better. But after a few days, it would wear off. So 20 years ago, I started developing, looking at the research, what are the vitamins and minerals that make these hormones? What are the amino acids, these building blocks that people should be getting in their diet, but can't get enough to be able to make the hormones that they need for the body to work correctly? And that's how I started developing the Fibro Formula years ago. And so this is, we talked about in part 1, we talked about 5-HTP. Okay, so that was all in the Jumpstart part 1, we talked about 5-HTP. So the Jumpstart supplements, there's 4 of them, 5-HTP, and you can see what 5-HTP helps you do there. Okay, then now we're talking about saturating your cells with vitamins and minerals, amino acids, and essential fatty acids, 500 times, 1,000 times stronger than the RDA. If you don't do that, you're not going to notice any difference. High doses, but safe doses of these things. So that's the Fibro Formula. And you can learn more about the Jumpstart protocols, which is deep restorative sleep. Number 1, you got to get that right. And 5-HTP. Number 2 is saturating your cells with high doses, but the right doses and combinations of vitamins, minerals, amino acids, and essential fatty acids, which is what is in the new Fibro Formula. And then next week, when we're talking about adrenal fatigue, how to diagnose that, and then how to correct that. And then the following week, we're going to be talking all about GI disorders, irritable bowel, yeast overgrowth. I'll talk a little bit about the elimination diet, some of the things that I use in my patients, food allergy, leaky gut. We'll get into some of that. But we're definitely going to be talking about malabsorption, reflux, bloating, constipation, how to solve those typically within 1 to 2 weeks once you start taking the Jumpstart supplements. But you can learn more about that at yourfibrostore.com. You can see the 4 supplements that make up the Jumpstart supplements, and you can watch the free videos at Your Fibro Store. There's also free resources at yourfibrodoctor.com. So there's testimonials, there's blogs, there's free videos, if you want to set up a new patient consult with me, I work with patients all over the world, either by Zoom or by telephone, and you can do that at fibroconsults.com. Okay, so that's what I wanted to share with you tonight. And now what I want to do is I want to take your questions. So I'm going to take your questions here on Zoom first, and then I'll do my best to navigate over to Facebook and get your questions over there. I'll wait just a minute and let people have a chance. So here, if you're on the Zoom presentation, you can use the chat box here and you can post something here if you got a question. So I don't see any questions here. I'll come back. So let me see if I can get over to, how do I do that? Here I go here. Whoop, I can get back to. Okay, so I'll come back here to Zoom. And then let's see if I can figure out how to get to these comments here. Okay, here we go. So I can see. Okay, great. All right, so Bex, if you missed part 1, or anybody, if you missed part 1, you can see it here on the Facebook page. This is where it is. Okay, so you can go back, and when you get a chance, it's still on here. You can see what we did last week. So Ravens from Australia, good morning. Yes, it's early there, right? You can't share. I don't know if you can share. You should be able to share this, but probably not until after we're through. Then you can share it. Okay. That's typically how I think Facebook works. Okay. So I'm going to go back to, no questions here. So I'm going to go back to the Zoom. And Marion says, thanks for recommending the 5-HTP in juice. That's making a big difference. I had been taking 5-HTP before, but not with the juice. Why does the juice make such a difference? So last week I talked all about 5-HTP combined with the Fibro Formula makes serotonin, and then the serotonin raises your pain threshold. So it reduces your pain, helps with mental clarity, helps with your moods. It's the happy hormone, helps with anxiety. But the reason why I recommend you use a little bit of grape juice or apple juice, just about an ounce, mixed with water to take with the 5-HTP at bedtime, is because it allows the 5-HTP, the serotonin, to get past the blood-brain barrier and get into the brain quicker. If you just take it with water, sometimes it doesn't get into the brain, it goes to the stomach. You have more serotonin receptors in your stomach, in your intestinal tract, than you do in your brain. And by using the juice that has sugar in it, the sugar causes your body to release insulin, another hormone, and that insulin hormone takes the serotonin into the brain. So that's why we do it that way. If you didn't watch if you missed that session, check it out. You could also, at your fibrostore.com, there's free videos. There's 4 jumpstart videos. They're short, but they're there. Okay. Yeah, you can use cherry juice. Yeah, you can use cherry juice, cranapple. I wouldn't use cranberry. I wouldn't use cranberry because it's a diuretic. So I wouldn't do that. But you certainly could use cherry juice. Yeah, tart cherry juice has a pain blocking effect to it as well. So costochondritis is very common in fibromyalgia. So costochondritis is an inflammation where the ribs attached to the sternum. So this where it attaches there becomes inflamed and it causes pain. And oftentimes people will go to the ER thinking they're having a heart attack, but it's just this costochondritis. It's an inflammation of the tissue here, where the rib head attaches into the sternum. So let me pause this here. So Eileen says, my MD told me not to take 5-HTP with sertraline due to serotonin syndrome. But last week you mentioned that not being a concern. Could you please help me understand this? Thank you. P.S. Is there sugar-free juice I could use? Well, the sugar is what makes it work. So it doesn't take much, but it's the sugar that makes it work. It wouldn't make, if you did it without sugar, you could try, just eat with a carbohydrate, because that's going to release insulin, but the sugar in the juice is what makes it work. So if you'll read that people will say this contraindicated, that you shouldn't take 5-HTP with an antidepressant because of the fact that you can get too much serotonin, and that can create this thing called serotonin syndrome. And yeah, that can happen. Is it common? No, it's rare. So I've been doing this for 20 years. I mentioned earlier, I have patients all over the world who are using my products, who are using 5-HTP. Now, I would tell you to be very, very careful about where you get your products, including 5-HTP, because there's a lot of garbage out there. And at one time, they banned tryptophan, which because it had a bad bacteria in there and it got contaminated, made a lot of people sick. But now 5-HTP should not have bacteria in it. It just comes from a plant. If you're know where you're getting it from, but it should not have any kind of bacteria. You shouldn't have any issue with that. So when you're taking an antidepressant, it doesn't make serotonin. If you're taking sertraline, if you're taking a selective serotonin reuptake inhibitor, but you've depleted your stress coping hormones, stress coping chemicals, including serotonin, there's nothing to reuptake. It's like using a gasoline additive in an empty gasoline tank. Once you start using the 5-HTP along with the Fibro Formula, then now that's what makes serotonin. So it's just like pouring serotonin into your brain. But to answer your question, I don't see serotonin syndrome. I've seen it 3 or 4 times in 20 years. And it's been from patients who abused the 5-HTP or were instructed not to take it because I knew they were so sensitive they were probably going to have a problem. If you start off with, as I mentioned last week, and you can watch the entire presentation, start off with 100 milligrams 30 minutes before bed on an empty stomach with a little bit of juice mixed with water. You'll know that night, if it makes you more alert, if it wakes you up instead of relaxes you, then you know that 5-HTP could give you trouble. And so you take it during the day with food. That will make it less active and less strong, potent. And most people who take 5-HTP, 99% of them will take it. It'll do one of two things. It'll either put them to sleep as they increase their dose up to 300 milligrams, or it won't do anything. If it doesn't do anything, then that's when you start adding the other things I mentioned last week. That's what 99% of people. Now, 1% of people, typically people who have chemical sensitivities, so have a lot of funny reactions to medications or supplements. If you're one of those people, then I still recommend you try 5-HTP at bedtime. But you may find that when you take it at bedtime, it wakes you up instead of puts you to sleep. If that happens, take it during the day with food. And I went over all that protocol last week. But just know that I have hundreds of patients, I guess, active patients that are taking 5-HTP. And at least in the beginning, until I help them wean off their antidepressant that really isn't doing anything, they're taking both and with no problem. Itching is common in fibromyalgia because what happens is your hypothalamus is not able to regulate the different systems in the body. And part of that itching comes from an overstimulated nervous system. Okay, that's part of that central sensitization syndrome where it's over stimulated, and that can create itching for sure. It's part of your nervous system's not working. Blisters on your scalp is a form of lichen planus. You can oftentimes it's what that's due to. It's yeast overgrowth sometimes. That's not normally associated with fibromyalgia, but I do see that with my patients sometimes. Oh, you're welcome. You're welcome, Eileen. All right, so I'm going to go. Let's see, how do I go back here? Let's see. Go back to Facebook here. Let's see what questions we got here. Okay. So someone's saying they're having trouble with their with their audio. I'm not sure really what to tell you about that. Sorry. Wish I could help you there. So Christine, don't really know a lot about floaters. I really don't. I wish I could tell you something really smart, but I certainly know what you're talking about. But I'll post in the rescue. I'll post you something in the rescue. Give me a day or so. So 5-HTP can make you feel nauseated when you first take it, although that's really rare. I rarely ever hear that. It can also give you headaches. The headaches and the nausea usually go away after a few days. If you have that reaction, give it a few days. If it doesn't work, then switch to tryptophan and see if you can take tryptophan. Okay. But I rarely ever see anybody have that problem. What's the cure? I'm giving you the cure. So Bex asks, what's the cure? The cure is getting healthy. That's the cure. That's the only way that works. Drugs don't make you healthy. They can be helpful because they can reduce the symptoms, but they're not treating the causes. What I'm sharing with you tonight and over the next couple of weeks is a way to jumpstart your health. And by using the jumpstart supplements, you're going to dramatically reduce the symptoms, the common symptoms of fibromyalgia. Because think about it, if you start getting deep restorative sleep, you're going to have more energy. You're going to reduce your inflammation, so you're going to reduce your pain. You're going to be less likely to have brain fog. Your moods are going to improve. You're going to be less anxious. As you are getting deep restorative sleep, reducing pain and helping all these other things, you're also going to get rid of restless leg syndrome because that's a byproduct of poor sleep. Your body's going to start working better. Your metabolism is going to improve. Everything starts to improve once you're sleeping better using the 5-HTP and the Fibro Formula. As you saturate your cells with these high doses of vitamins, minerals, amino acids, and essential fatty acids, now your body has the building blocks it needs, the chemicals it needs to start to correct these underlying problems with oxidative stress, mitochondrial defects, overstimulated nervous system, low pain threshold. That's why it works. So when people ask me, and I just did a presentation, some of these slides actually for a presentation I did in Italy for functional medicine doctors in Italy. The reason why it works is because we're using these natural supplements to raise your pain threshold, to get a good night's sleep, and then you'll see we're going to fix your stress coping gland, the adrenal glands, to keep you from having fibro flares, to give you more stamina and resiliency to stress. And then you'll see the following week, we're going to talk about digestive enzymes and things you can do to make sure that you're digesting your food and utilizing the nutrients in your food. We're going to talk about that and how to get rid of irritable bowel, typically within 2 weeks. So the 5-HTP combined with the right vitamins and minerals and amino acids, and that's what's in the Fibro Formula, which I showed a slide of that earlier. And if you go to your Fibro store, you'll see the Jumpstart supplements there, and you'll see the free videos. Thanks, Alyssa. I appreciate that. So that you can share. I'm not able to see it. You can see it on your screen. Kimberly says, Dr. M knows his stuff. He saved my life. Love dropping in here and sharing my truth. Thanks, Kimberly. Appreciate you doing that. Beck said found it. Okay, good. Joanne says, will 5-HTP ward off dementia and Alzheimer's? No, it doesn't really, unfortunately, it doesn't affect those conditions. But deep restorative, lack of consistent deep restorative sleeps makes you more likely to develop these things. But low B12, thiamine, pantothenic acid deficiencies in those B vitamins can definitely cause problems. And everybody has deficiencies. The United States government came out, USDA, United States Dietary Association came out several years ago and said everyone's deficient in B vitamins. So, and B vitamins are what make our brain chemicals. They, that help us to be able not to have dementia. B1, thiamine. We'll talk more about dementia in part 4 because you can develop pre-senile dementia once you get malabsorption syndrome, which that's what we see oftentimes. You're not absorbing your food correctly because you have a deficiency in stomach acid. We'll talk more about that in week 4. So Alyssa, if you go to, I can just probably post it here. If you just go to yourfibrodoctor.com and look under patient resources. Okay, it'll be a link at the top, click on that and you'll see health conditions. And it's the brain function questionnaire. So I encourage everybody to take the brain function questionnaire at yourfibrodoctor.com. Look under patient resources and then under health conditions. Thanks. Yeah, thank you, Christine. Appreciate you so much. Okay. So Kimberly says, yes, costochondritis is and was horrible, an inflammation of the cartilage between the breastbone and the rib cage. I ended up in the hospital multiple times thinking I was having a heart attack. Haven't had it since getting myself together with Dr. Murphy's or Dr. M's coaching program. The Jumpstart protocols have changed my life. So thanks, Kimberly. I appreciate you sharing. I really appreciate you sharing that. Okay, let's see. How do I go? Oops. Okay, I think I've gotten all those. Okay, so it's the www.brain. No, that ain't gonna take you there. Sorry, I thought I could take you right there. I think you have to go to the website, your Fibro Doctor website, to be able to access that. So, okay, let's go back here and. So the book right now is out of stock. You can go on Amazon. I think they're selling it for $100 a piece or some crazy name. Amazon drives me crazy. I think it's highway robbery because anytime I go to a book signing, I sign a bunch of books. Next thing I know, they're all on Amazon, and I don't get a penny of that. Nor does my staff or anybody that helps me put the book together, but you can get the ebook, Adriana. You can get the ebook at yourfibrostore.com. In a few months, the new version will be out. But the ebook is available at yourfibrostore.com. And the ebook's probably maybe available on Amazon as well. I don't think so, but I think it's taken off of there because we're redoing it. Marianne asks, is the Fibro Formula best taken all at once or split up? So the Fibro Formula it's a canister, okay? And depending on your weight, if you weigh less than 150 pounds, you take 5 capsules a day and you spread those out. So two in one, or however you want to do that. But you spread it out, take it with food. If you weigh over 150 pounds, and I recommend you take 10 capsules a day and you spread that out. So 3, 3, and 4, whatever, but spread it out, take it with food. Now, if you get a loose bowel movement, then you reduce your dose. So if you're taking 10 and you get a loose bowel movement, then you drop it down to 9. If you continue to have a loose bowel movement, drop it down to 8. The loose bowel movement would come from you're getting too much magnesium for you. Now, there's no way to know exactly what you need on any of these vitamins. So what we want to do is saturate your cells, because we are as different on the inside as we're on the outside. So for me, I can take 800 milligrams of magnesium and be fine. The reason why it takes, and oftentimes even more than that, because I'll get cramps during the night. You know what that's like, many of you, because of working out, playing pickleball for 2 hours, or downhill mountain biking, or running, or whatever. I'm playing tennis or whatever it is. Do an hour, exercise an hour or more daily. And if I'm not careful, I become depleted in these nutrients as well. Anytime you're under stress, you're using these nutrients, and one of those is magnesium. Okay. For one person, for me, I can take 800 milligrams and be fine. Another person tries to take 800 milligrams, they're going to be in the bathroom all day, because it relaxes things, right? It's relaxant. It relaxes your muscles, but it also relaxes your colon. So depending on your weight will determine how much you're taking. And in that, if you're taking the Fibro Formula, there's no need to take a multivitamin, a hair, skin, and nail formula, extra calcium. I mentioned it has CoQ10 in it, which helps with oxidative stress, helps with energy, helps with pain. It has antioxidants in there, so you don't have to take an antioxidant formula. It's got everything in there that you need. And then you build around that with the 5-HTP, the adrenal cortex, and a digestive enzyme. Okay. There is a test for magnesium deficiency. There's a blood test, but it's a special type of blood test that doctors usually don't do. So I don't even test for magnesium deficiency. I just have patients take magnesium because I know they're deficient in it. Everyone's deficient in it, and in particular fibromyalgia. And you just increase it until you have a loose bowel movement, and then you reduce the dose. But if you're taking the Fibro Formula, let's say you're taking 5 capsules and you're still constipated, then you want to add additional magnesium. I wouldn't add additional Fibro formula capsule. I would just add the magnesium, but you'd add magnesium citrate or chelate or glycinate, 150, 200 milligrams, and you'd keep adding that until your constipation turns into a loose bowel movement, and then you reduce the dose. Now we'll go over much more about that in part 4, but that's a good question. So Marion says, okay, I've been working my way up with the Fibro Formula. Is great. Thanks again. Good. So Eileen says, I'm currently taking 600 milligrams of magnesium. Maybe it's not a good type. Magnesium, but glycinate's fine. That's a good formula. Yeah. I wouldn't do oxide, but glycinate is fine. No problem. If you elect to do the Jumpstart supplements, the Jumpstart protocol that I'm sharing over the next 4 weeks, then if you take the Fibro Formula, I would discontinue the extra magnesium, and only add it if you need to add it. If you need it, fine, but otherwise you can stop it. I'm taking magnesium malate. Is that good? The magnesium malate helps with cellular energy. It's very good. It's what's in the Fibro Formula along with magnesium citrate. I like that combination. So there's a special form of magnesium. It's called magnesium potassium aspartate, which is helps with malic acid, and there's also malic acid in the Fibro Formula as well. But yes, magnesium malate is a good form. It sure is. Okay. Let's see. Okay. All right. So we'll switch back over and see what questions I have on Facebook. Let's see. Okay, so answer that. So, really, I mean, there really is no cure for fibro. I wish I could wave a magic wand. I wish there was a cure. Now, having said that, you can get your life back. But the only way to do that is you got to get healthy. And it's a process. The reason why I developed these jumpstart protocols was it was a way to dramatically improve the common underlying causes of fibromyalgia. If you don't do it this way, then it's all, you can go off on different paths. You can go off, you can do all sorts, there's all kind of stuff out there, but it's haphazard and it doesn't work. This is a proven set of protocols that has clinically shown time after time after time to be incredibly helpful at dramatically reducing the common symptoms of fibromyalgia: pain, poor sleep, restless leg syndrome, which typically goes away in a couple of weeks, irritable bowel, which typically goes in a couple of weeks, bloating, gas, anxiety, depression, fibro fog, fatigue. And the reason why I developed the Jumpstart protocols, because it was designed to, as quickly as possible, to make a dramatic improvement in that individual's, fibromyalgia challenge. Now, it doesn't end with the Jumpstart protocols, because this is just lays the foundation. It's if you have a table here and we only have two legs, it's going to wobble, or if we have three, it's definitely going to wobble and maybe fall over, so it's not balanced. But if we have all four layers, all four legs of the table, now we have a foundation. Now we can put things on the table, and the table is useful, we can use it. And that's what the four supplements, the 5-HTP, the digestive enzyme, the adrenal cortex, and the Fibro Formula, those are the four legs. If you want to do something different with that table, though, you're going to have to do something different. So what many of you will find is that as you use the Jumpstart supplements, you'll see within a couple of weeks that you have less pain, more energy, your sleep oftentimes turns around using the sleep protocols I shared last week. Most of your symptoms will dramatically be improved, but you may find a month into it, or 6 weeks into it, or 2 months into it, you still just don't have the energy that you need. And, maybe you're losing the lateral third of your eyebrows, or your hair's falling out, dry skin, brittle nails, tingling pain, cold hands, cold feet. It could be that you have a problem with your thyroid that no one's ever uncovered or is not treating properly. And if that's the case, then there's protocols for that. You could continue to have a lot of problems with your GI system. So irritable bowel is associated with fibromyalgia. 70% of the people with fibro have irritable bowel. I find 90% have some kind of GI problem, whether it's just bloating and gas or malabsorption. They're not absorbing the nutrients when they eat. But if you're using the Jumpstart protocols and you continue to have loose bowel movements, then you need to maybe add something like S. boulardii, which is a probiotic, okay? Or you might need to increase your 5-HTP to increase your serotonin, which will slow down the elimination process. So it's not the Jumpstart supplements, these 4 supplements and these protocols that I've developed, they're incredibly helpful, but they're not the end all be all. So you need to know that. If you want more additional help, if you have other issues, whether that's problems with your thyroid or SIBO or yeast overgrowth or leaky gut or some of these other things that can continue to give you pain and low energy and brain fog and GI issues, then that's when you set up a consult. Or if you just feel like you need more help, you're sick and tired of being sick and tired, you're ready to just cut to the chase, have someone who really knows what they're doing, hold you by the hand, tell you exactly what you need to do, how to do it, when to do it, then that's when, set up a consult, and you can do that at fibroconsults.com. We also have a fibro coaching program that some of the people that are posting here are in, and that's a group coaching program for a nominal fee. Every couple of weeks I come on and do this, but I do it, you get access to all the training videos, not only on the Jumpstart videos, but also on the videos on thyroid, the videos on SIBO, the videos on mold toxicity, the videos on Lyme, the videos on food allergies, and the list goes on and on. So if that's something you're interested in, you can learn more about that at yourfibrostore.com, and it's the Fibro Rescue Program. Okay. Let's see what happens here. Okay. Okay, so I've gone over the hour mark. I'm going to take a few more questions. So, Adriana, how many magnesium malate should I take? Well, you should take it until you get a loose bowel movement, then reduce your dose. Remember, as I said, where it's different on the inside as around the outside, I can't tell you how much you need. In the Fibro Formula, which is what I encourage you to take rather than taking the magnesium by itself, in the Fibro Formula, if you take 10 capsules, you're going to get about 700 milligrams of magnesium, including malic acid and magnesium malate. You'll get 700 milligrams. Obviously, if you're taking half the dose because you weigh less than 150 pounds, then you're going to be getting about 350 milligrams. And you might be able to add some additional magnesium, which I would recommend because, again, it's a natural muscle relaxer. Magnesium is in 300 different bodily processes. And when it's deficient, and it can become deficient anytime you get under stress, physical stress, physical activity, or mental, when you get under stress, you're using magnesium and you can easily become deficient. So you need to be taking, you need to supplement with magnesium. But if you have a deficiency in magnesium, 300 different reactions are going to suffer from that. Brain fog, mitral valve prolapse, high blood pressure, constipation, tight achy muscles. These are all signs of low magnesium. Let's see, I saw something about inflammation. I must have passed it. I'll have to go back to find that. But someone had posted about inflammation and turmeric. So turmeric is good. That's fine. But getting deep restorative sleep is going to dramatically reduce your inflammation. Raising your pain threshold is going to dramatically help you with your pain. Reducing oxidative stress by taking the Fibro Formula is going to dramatically reduce your inflammation. Then and only then, if you continue to have inflammation and pain, that's when I would add turmeric. But before, the thing is, there's so many great products out there, right? You can take all this stuff. And early on, when I was working with fibro patients, I would tell them, just go to the health food store and tell them you need this, this, and this. Well, they would go to the health food store and then they come back with 15 bottles of stuff. 12 bottles they didn't need, okay? There's all kind of great stuff out there, but what you want to do is prioritize what is it you need to take that's going to make the biggest difference in your symptoms, that's going to start to correct the underlying causes of your symptoms. Symptoms are just warning signs that something's wrong in your body. That's it. So taking a pain pill because you got pain doesn't stop the pain, okay? Not long-term. It only lowers the pain temporarily. But if we can raise your pain threshold, and that's what the Jumpstart protocols do, as we raise your pain threshold, pain goes down. It doesn't matter where it's coming from. And then along with that, as we're starting to help you have more mitochondria, okay, and help the ones that are dysfunctional with the nutrients that you're taking. So now they're starting to work better. You're starting to create more. And we're starting to reduce oxidative stress, which creates inflammation. As you're starting to reduce oxidative stress, you're going to see you have less pain, more energy, better mental clarity. So yeast overgrowth is common in fibromyalgia. I wouldn't treat that first. I would do the jump start first, lay that foundation, and then and only then, if you're not improving, and typically it'd be more with your bowel movements and other things, but then I would treat yeast overgrowth. And a big part of that is correcting food allergies, and the biggest part is leaky gut. Okay, good. So, okay, all right. Okay, so just go take a couple more questions. Let's scroll down here. Deborah, so inflammation in your upper intestines. The thing that I like for that, in addition to what you're already doing, because I know you're taking the digestive enzymes and you're doing the fibro, or you were, I know you were at one point, I know. You were using the jumpstart protocols. Secure. You were using the jumpstart protocols. Let's now goof this up. Okay, now you lost my volume, or let me go back to, let's see, someone can give me a thumbs up if you can hear me. Can you, on the chat box, if someone can just let me know that the audio is still working? I think it is. Okay, good. Okay, didn't turn off. Good, great. Okay. So Secure, SEACURE. It's a special form of fish oil that is really a potent anti-inflammatory, and it's great for the digestive system. Then the other thing I would do would be the leaky gut formula, which is in the store, your Fibro store. That can be very, very helpful with the inflammation, and then probiotics. So those would be the things that I would do for intestinal inflammation. Okay. But the question is, why do you have intestinal inflammation? I think you have already done allergy testing, food allergy testing, but that's something I'd recommend if you've not done it. If you have inflammation in your intestinal tract, what's the cause of that? A lot of times it's foods that you're eating, you're having an allergic reaction to them. Okay, so I'm going to wrap things up. Let's see if I can do this. So I just want to show, let's see. This is, whoops, we don't want to get into that. Don't have time to get into that. So here's the websites I want you to look at. So yourfibrostore.com, there's 4 videos. They're short. They're on the Jumpstart. It's called the Jumpstart videos, and you'll see those 4 of them. So I would encourage you to check that out. You can also, while you're there at Your Fibro store, you can see the Jumpstart supplements. There's 4 of them there. When you order those, we will send you a how to take sheet, and we'll send you we'll send you resources to help you use those products. I want you to be successful. I don't want to just sell you these products. I want you to be able to take them and benefit from them. Okay. I'm very particular about what I recommend, and that's patients that work with me, they use my products at least initially to make sure that they work. There's a lot of stuff out there that's not good. and you can take it and it doesn't work. And then you get discouraged and you think, oh, well, 5-HTP doesn't work. Well, it's not that 5-HTP doesn't work, it's that you're taking something inferior that didn't even have 5-HTP in it. Has it on the label, but it's not even in it. So be careful what you get. Your Fibro Doctor, there's all kind of freebies on there. So there's free reports, there's free videos, there's blogs. You can find patient resource area where you can look at health conditions. You can take the brain function questionnaire. That's where you can find all those things. Okay. So until next week, until next Wednesday, this is here's your homework, but I want to encourage you to go ahead and get the Jumpstart supplements. Go ahead and start taking them so that next week you can start sharing with me how you're doing and what we need to work on, to help you. Next Tuesday night, you might want to tune in. I'm going to be doing a thyroid Q&A. So all about your thyroid next Tuesday night, 6 p.m. Central Standard Time. And you can learn more about that. Make sure you're on my email list, and you can get on my email list just by downloading any of the free reports at yourfibrodoctor.com. Get the free report, and then you'll be on my email list. You can cancel anytime you want to with a click of a button, but that'll get you the information you need to be able to sign up for the free thyroid master class Q&A next Tuesday night. And then next Wednesday night, I'm going to be doing part 3 of the Jumpstart protocols. We're going to focus all on energy, how to get your energy back, how to get your stamina back and resiliency back so you can do the things that you love to do but hadn't been able to do without having fibro flares. Okay. So we're going to talk about that next week. And then the following week, part 4 will be all about GI disorders. Okay. So until then, this is Dr. Rodger Murphree, your fibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome.